Good morning. I'm so glad and so happy that you can join us for our fourth annual Strolling Thunder Think Babies Advocacy Day. Welcome to everyone. It's so nice to see all of your beautiful and smiling faces. I'm Rhonda Rivers, a member of the board of the North Carolina Early Education Coalition, a proud member of the leadership team for Think Babies North Carolina Alliance. In my everyday work life, I am the Regional Director of Curriculum and Training for Leaf Spring Schools of Charlotte, North Carolina, and I also have the privilege of serving as a Vice Chair for the North Carolina Child Care Commission. It is wonderful to see so many baby advocates joining us today. We certainly wish we could be in person today to meet and greet each other, but we are so happy that you have all joined us for a fun and powerful virtual event this morning. Please be sure to introduce yourselves to each other in the chat. And for those who are interested, we are providing Spanish interpretation today, thanks to Felipe at Language Service Solutions. So please click the globe icon at the bottom of your screen and select Spanish if you would like to hear this event in Spanish, okay? It is my honor to kick off today's Strolling Thunder event and showcase the work of Think Babies North Carolina Alliance, which is led by a wonderful group of cross-sector leadership team members, local and statewide organizations. The Alliance is a proud partner in the National 0 to 3 Think Babies campaign and in the Pritzker's Children's Initiative's National Collaborative for Infants and Toddlers. I'd like to extend a special thanks to our Think Babies Alliance partners at Moms Rising and the North Carolina Association for the Education of Young Children for their support and commitment to this event this year and every year. Most of all, I want to thank you for joining us this morning. I don't know if it's raining where you are, it may be a little dreary, but it's Friday. And anytime you get to see the face of a beautiful baby on the screen, I think it wakes all of us up and make us feel hope and feel inspired and feel like there's more that we can do to make sure their futures are bright and that they fulfill their promise. Today and every day, it's time for us to be a big voice for babies and to tell our policymakers at all levels to think babies and make their potential a top priority. Our state's babies are counting on us. Their families are counting on us. Why do we want to put a spotlight on what all babies and families need to thrive? Well, the science is clear. Our brains grow faster between the ages of 0 and 3 than any later point in our lives. And we need to capitalize on that opportunity. We need to seize that moment, ensuring that babies have healthy beginnings, supported families, and access to high quality early care and learning has an enormous impact on how a child learns and grows throughout his or her lifetime. It starts during that critical period. COVID-19 has been devastating for many of the support systems, as it has been for us and our families, but particularly for our youngest children and families, from childcare to home visiting. Imagine that during the pandemic, with the limitation or us not being able to make those necessary home visits, to healthcare. And it has exacerbated the existing challenges and disparities faced by babies and families across North Carolina. Each and every day, the pandemic is shaping the early experiences of the 361,000 infants and toddlers in our state, in the beautiful state of North Carolina. Their potential must be our top priority in our recovery. It must be, and beyond, to ensure that all babies have a strong foundation for success and not a future that is undermined by the effects of this crisis. We know that babies and their families are facing challenges, many challenges today, especially families of color or families that are low income, who are often overburdened and under-resourced. And many of them were in that position before the pandemic, and the need has certainly increased during this pandemic. About half of the babies in North Carolina are children of color who face systemic racism and barriers to the resources and opportunities that they need to thrive. 40% of infants and toddlers in our state live in families that are experiencing poverty or with low income. 60% of babies live in households where all parents are working, which makes things like paid leave and high quality childcare absolutely essential and necessary. But too many families don't have the support they need to make these changes, to make these things accessible and affordable. And it's necessary and it's needed in our state. You can learn more about the state of North Carolina's babies on our website. Please visit that website. It's loaded with information, ways for you to connect. The bottom line is that when we support babies in the earliest years, not in pre-K, in the earliest years, we prepare them to grow, learn and succeed, and our communities, our workforce, and our economy become stronger. The Think Babies North Carolina Alliance is laser focused on promoting public awareness and policy solutions. And Ms. Elaine has some information about that on the screen, if you can just tune into that a little bit. Policy solutions that support the healthy development and learning for all babies and their families in North Carolina, regardless of race, regardless of family income, and regardless of zip code. Together with our partners across the state, we stand together and we urge our federal, our state leaders, our local leaders to focus on ensuring that all babies, every baby in the state of North Carolina has a healthy beginning, supported families, and early learning opportunities. So our policy priorities are, and they include increasing funding for child care assistance to allow more families to work and make sure babies receive high quality early learning experiences, and better child care subsidy rates to provide the financial support that is needed by families and to support child care programs that serve these families. The next priority, strengthening the early childhood workforce with increased compensation. That's one of the many things that I'm passionate about. Parents need qualified workforce. The children need a qualified workforce, and it starts with our babies. To make sure that our babies and their teachers have the support so they can have that healthy development and learning opportunities as early as possible. We need a qualified workforce, and we need to strengthen that workforce. Expanding home visiting and parenting education programs to provide critical support for our families during a time when every family is most stretched in their new parenting role. And I saw one of our guests that mentioned that he has a new 10-month-old, and I'm confident that he understands how important these priorities are. Closing the health insurance coverage gap to help ensure healthy births, reduce infant mortality, and promote an on-track development for our kids is necessary. Providing workplace accommodations for pregnant mothers and extending postpartum Medicaid coverage to reduce inequities that begin even before birth and to ensure parents and their babies are healthy right from the start. And last but not least, we must offer paid family leave and paid sick leave to support parent-child bonding and to make sure that no parent has to choose between their job and the health and well-being of their baby. North Carolina state legislators and our members in Congress need to hear that it's time to think babies. It's not an option not to think babies. So it's important that everyone that's on this call, on this Strolling Thunders event today, that we continue to rally together, that we listen today, and that we come together on Monday and we discuss what we can do to move forward. It's important that they hear from us. It's important that they hear from you. That's why we're all here today. It's time to make more than baby steps. We have to work together and take action to make sure that babies and their families are our #1 priority. Okay, so let's take a look at our agenda for today. We have an exciting jam-packed agenda for today. In the next hour, we're going to have 2 panel presentations. You will hear from North Carolina legislators about why they think babies as they talk about legislation they have sponsored around this. You will also hear from a panel of parents, so happy to have them as well, who will share their experiences with childcare, home visiting, paid leave, and other supports. Following these presentations, we'll all take time to share, to discuss, to synergize why we think babies together, and then we'll break into advocacy workshop. That's where the work begins. so we can strategize. Throughout the day, there will be social media and advocacy activities. So please join us on social media using hashtag Think Babies North Carolina. So if you have your phones, have those ready and get people to log into this event even as we're talking and sharing. Okay. All right, so without further ado, I would like to introduce our distinguished panel of North Carolina state legislators. So happy to have them with us today. Representative Greg Meyer represents District 50, which includes Caswell and Orange counties. He is in his 4th term in the House and serves on the K-12 Education and Appropriations Committee and has introduced numerous bills to support families and babies. He's here today to talk about his work to ensure all families have access to paid family and medical leave. We're glad to have you, Mr. Greg Meyer, Representative Greg Meyer. Next, we'll hear from Senator Natalie Murdoch, who represents Senate District 20, which is in Durham County, and she's serving in her 1st term in the Senate. Congratulations and welcome, Senator Murdoch. We're happy to have you here. She is a member of the Health and Human Services Appropriations Committee and also serves on the Transportation and Prison Safety Committees. In her 1st term, she has become a big baby advocate, focusing on maternal and infant health disparities. We're so excited to hear that. She is a primary sponsor of the North Carolina Momnibus Act and is here today to talk about her bill to guarantee pregnancy accommodations in the workforce. And last but certainly not least, Representative Julie Haven represents District 36, Wake County. Welcome, Representative Von Haven. She is in her 2nd term in the House, and I apologize for mispronouncing your name. It's Julie Von Haven. She is in her 2nd term in the House and serves on appropriations and the state and local government committees. Representative Von Haven has been a tireless champion for early childhood education. And today she will focus on her efforts to promote better child care subsidy rates to support programs serving infants and toddlers. Thank you, Representative. Let's give all of our speakers a virtual applause as they come. We'd like to welcome them and thank them for being champions for Think Babies. So first, we'd like to start with Representative Meyer. If you will start for us, we're so happy to see you and have you on with us this morning. Welcome.
Thank you, Rhonda. It's great to see you all. It's good to see so many friends and some folks that I don't know. I wish that we could recreate some of the scenes from that video where you all showed up with strollers and we met you at the legislature, but I'm happy to see you even virtually. I hope that even though you're not at the General Assembly, you will take the opportunity to reach out to our colleagues in the General Assembly
Absolutely.
today. They do need to hear you. That's the reason why you're here
Absolutely.
today, not just to see friends, but to talk to those folks that we need to convince. I'm very proud to once again be the primary sponsor of our major bill to introduce paid family leave to North Carolina. House Bill 597, the North Carolina Paid Family Leave Insurance Act, would set up a shared insurance pool where workers and employers would pay in the same way we pay into unemployment insurance to set up paid family leave for every worker in North Carolina. You'd be eligible for paid family leave to take care of a child, whether you had the birth of a child, adoption of a child. You'd be eligible for paid family leave to care for someone in your family, whether child or adult, who needs healthcare assistance. You'd be eligible to have paid family leave if you needed to care for someone who was serving in the military and was wounded and needed your assistance once they returned home. It's a great bill, and I don't have to convince y'all why it's important for babies, why it's important for mothers and fathers. You know those reasons. You're here because you already believe those things. What I want to do is help you think about how you advocate for this bill with those folks who don't already agree with us 100%. The major resistance to paid family leave in North Carolina comes from employers who are afraid of the cost that it would put onto employers when they had to help pay into a paid family leave insurance pool. And I want to be specific. The cost in our proposed bill is only $2 a month for every employee and every employer. That's $100 a year out of every employee's paycheck and $100 a year out of every employer's pocket. And if you just put that $100 a year in for each of your employees, your employees would all get paid family leave that you don't have to pay for as an employer. It would come out of the insurance pool. This is a great deal for employers. Now, right now in North Carolina, we are on a comeback from the lowest days of the pandemic when we had 7.1% unemployment, and we're all the way down to 4.4% unemployment, which is a tremendous victory for the investments that we've had from President Biden and the work that Governor Cooper has done. And we're really glad to be able to get most of those folks back to work. The debate now has changed to, are we facing the labor shortage, and why are we facing that labor shortage? And the debate this week in the legislature got simplified down to unemployment benefits. But when we asked the Division of Employment Security for why are people not returning to work, the number one reason why they're not returning to work is because they don't have adequate childcare. And the number two reason is because they either have their own healthcare challenges or they're caring for someone who does have healthcare challenges. Now, when folks leave the workforce because they have to take care of a child or they're dealing with healthcare challenges, they often leave their job permanently. Maybe they'll go back to that job if it's available, but there is no system for you to leave a job temporarily and then come back to it as we would have if we had a paid family leave system. And so I think we should be telling legislators that if they want to address our labor shortage right now, paid family leave is one of the best ways to make sure that we have a system for people to return to the jobs that they've been trained in, because they can take the paid family leave, not unemployment, and then return to their jobs when they're ready to do so. And because we would do this through a shared insurance pool, the cost to employers is minimal. So we can tackle the most important resistance to our case for paid family leave and do what we need to for the youngest children and their families in a way that I think would be great for the future of North Carolina. And I hope that you will help us make that case. Thanks to Senator Murdoch and Representative Von Hafen for also supporting that legislation. And I am happy to support what they're going to talk to you about. And I'm really want you to know how impressed I am with the job that the two of them are doing in their first and second terms to stand up and get people to think babies, including Representative Von Hafen's fantastic speech on the floor yesterday about childcare and how expensive it is. Thanks for having me here. I look forward to taking any questions you have in the chat. I'll stick around for a few minutes.
Awesome. Thank you so much, Representative Meyer. That was so encouraging. I see the hands and the applauses in the chat. Please continue in the chat so that you can see them, right, Representative Meyer, and then you can respond to them if need be. It's important that this conversation begins today, but it continues every day. And we're excited to hear next from Representatives. I apologize. I know this is a really important distinguishment for all of you, but Senator Natalie Murdoch. And it was just so inspiring to hear you acknowledging her and the work of your other colleague. And so welcome, Senator Natalie Murdoch. We're excited to have you. Welcome to your position in your first term, and thank you for jumping right in the reins and making families and babies in North Carolina a priority.
Thank you so much, Rhonda. Thank you so much for having me, and happy to be with all of you this morning and Think Babies, and to be joined by two of my favorite House members, Representative Meyer and Representative Von Hafen. So happy to be here with her. She's a huge part of this journey. Momnibus actually came about because she and my other phenomenal colleague, Representative Zach Hawkins in the House, did phenomenal work on implicit bias around maternal health care last session. And so wanted to build upon that and to introduce a full-on momnibus. So again, Natalie Murdoch, I am the senator out of Durham, North Carolina, District 20. And I'm actually campaigned on wanting to focus on maternal health. I am of childbearing age. I have had far too many friends, specifically as Black women and women of color, who have had near-death experiences simply by giving birth, and was really inspired by Congresswoman Lauren Underwood, as well as our own Representative Alma Adams, who, as you all know, served in the House for a long period of time and was following their momnibus work. So to step back, momnibus is an omnibus bill focusing on moms and maternal health issues. And they introduced this legislation in the previous session. As we all know, we've had a lot of changes federally, so they now have the support they need in Congress to move forward on momnibus. And so it's a collection of about 12 acts. And so was optimistic that this would pass at the federal level, and talked with Representative Von Hafen, Senator Sidney Batch, as well as Senator Deandra Salvador, that are the other primary sponsors in the Senate, and said, we need to pare this down at the state level. In the event that it passes federally, let's be proactive and figure out what modifications, what we need to make in the state of North Carolina to fill in current gaps we have in regards to maternal health. So with that, Momnibus was born. We were working really hard with a number of local and national partners, such as Moms Rising, the Center for Reproductive Rights. We would not have a bill if it were not for them. Equity Before Birth with Joyce Spencer, Mame. So many organizations, NARAL, Planned Parenthood, the list goes on, of all the groups that we consulted with throughout this journey, as well as a number of doctors. Duke Health is in my district, and so many people travel from all over the state to give birth right here in this area, either at UNC Health or Duke Health, or one of their outstanding locations. Chances are, if you have a high-risk birth that is within a few counties, they will typically transport you and your child to Duke Health. And so we wanted to be a leader in that and to build on some of the work that they're already doing. So some of the big components of Momnibus are, first and foremost, to address implicit bias. Studies are showing that you could be a woman of color with the same health background, same education, kind of same demographics, and for whatever reason, you are more likely to have issues at childbirth than a white woman. Black women are 3 to 4 times more likely to die from childbirth, and we're just failing as a whole. The March of Dimes has given our state a D+. We know we can do better than that. We've got to do a better job with infant mortality. We rank in the 30s nationwide, and so the data is very clear. So it's for that reason we want to work with these healthcare systems to figure out what is it that we're missing in regards to the care that they receive before they give birth, and even postpartum. I know there was mention of Medicaid coverage for women 12 months after giving birth. That is something we support. It wasn't in Momnibus because luckily in the Senate, we had 3 Republican colleagues, 2 of which are co-chairs of the healthcare committee that actually sponsored that legislation. So we'll still keep an eye out. It's not too late. Oftentimes bills may not move forward, but they still can be addressed in the budgeting process. We will keep an eye out for that. We also wanted to have a section for our veterans. Luckily at the federal level, that piece of the federal Momnibus is actually moving forward. It has made it out of Congress. In North Carolina, we have a huge veteran community. Either women that are currently serving or that have previously served have very unique challenges since they're deployed and move a lot, just need an additional level of support. Even basic things through our VA hospitals having more accommodations is something that I'm just starting to learn about. And also women that are struggling with domestic violence and other very serious issues. They are plagued with that as veterans. So we've actually found a nonprofit that we would like to fund to assist with that work. COVID-19, we're still in this pandemic. Unfortunately, I actually had a family friend that tested positive for COVID while she was pregnant, almost died herself, unfortunately lost her child. It was her first child. She was full term and had to be airlifted to Duke Hospital. So we found that women are having very unique challenges during COVID being pregnant. And the final portion will address community-based organizations such as Equity Before Birth, Mame, across the state. We've only identified about 12 or so organizations that really do that true community-based work to focus on women who are at risk and giving them all the support they need. We've talked about paid leave. Equity Before Birth, unfortunately, they are actually just giving mothers money so that they can stay home because they do not have the paid leave they need from their employers. And we also want to address social determinants of health, your inability to get the nutrition you need, transportation to those doctor's appointments that become more frequent towards the end of your pregnancy. We have to do a better job addressing that. Hopefully with social determinants of health, with Medicaid transformation, there is a provision in there for healthy opportunities. I do think that could be a foundation to address some issues regarding social determinants of health, but we will have to fully fund that to make sure that women that are expecting would have the ability to get the full benefits of that. Also want to touch on the Healthy Pregnancy Act. Again, Congress has gotten it right. The House has moved forward with this. Their legislation is called the Pregnant Workers Fairness Act. So at the state level, we filed that legislation, myself, Senator Sidney Batch, and Senator Natasha Marcus, to provide reasonable accommodations in the workplace. You have all been there where you may not feel that you have the support that you need in the workplace as you're doing all you can to work as long as you can until you give birth. And we're really behind the ball on that. And I will admit, since this is an advocacy day, this one was particularly unfortunate because we actually had bipartisan support and ended up filing it towards the end of the deadline in the Senate when we learned we no longer had that bipartisan support. So we really need to continue to advocate for these mothers to have the support that they need in the workplace. And finally, I'll highlight another piece of legislation that is part of Momnibus to provide doula coverage with Medicaid. Some other states have already started doing this, such as Virginia. I have a colleague in Kentucky that also filed this legislation, but studies show that you may have a better opportunity getting the additional support you need separate from your OBGYN through postpartum issues and just having that support, other assistance with nutrition, if you can have a doula. And unfortunately, a lot of folks can't afford those. So one of our primary sponsors in the House, Representative Renetta Austin, her wife had a phenomenal experience with her doula, so was thrilled that she and Representative Von Hafen joined me on that legislation as well. So can't stress enough how thrilled I am to join so many advocates in the General Assembly as we work to do everything we can to protect mothers and improve our outcomes, because again, the data is telling the story. We are simply missing the mark, and we have to do better for women and their families. They deserve that from all of us in the General Assembly.
Wonderful, Senator Murdoch. That was listen, you hit the ground running. You really did. Yes, absolutely. But it just goes to show to all of us that are on the call, those of us that are advocates for early childhood, how important it is to have representation at the state level that is diverse. Not only in race, but also in lived experiences. Because just as you said that you are childbearing age and you've had those situations or examples with your own friends, it allows you to present these bills with passion and fervor and with examples that you have been listening to the voices of North Carolinians and you know what's important to serve children and families. Thank you. Just thank you. So excited to hear from you, Representative Meyer. I feel, guys, you should be on social media sharing this information and having your colleagues and people that you know in the community, they need to follow these wonderful legislative panelists that we have today and to hear what they're saying and figure out how we can continue to rally our voices together and make sure this work gets done. Thank you, Representative Murdoch. You will continue to hear from us. You will see us, and we stand behind you on this. Thank you for this work, okay?
Thank you.
All righty. All right. Wonderful. Keep the messages going in the chat, guys. It's exciting. And last, but certainly not least, Representative Julie Von Haven from District 36. Welcome again. It's so great to see you back and to hear the work that you've been doing. Please share with us what you're working on now. Welcome again. Thank you.
Thank you, Rhonda. It's so great to be with you all today. I see so many friends and colleagues and fellow advocates in this work. So thank you so much for inviting me. Again, just thanks to Representative Meyer and Senator Murdoch for all of our work together. Senator Murdoch and I have worked on many, many bills together this session, and I'm really thrilled to have such a strong partner in this work over in the other chamber. So I wanted to talk a little bit about a bill, just one of the bills that I filed this year to support women and babies and this work, and that is House Bill 574, which is regarding childcare subsidy rates. And I know that it sounds a little wonky and a little boring, but it's really, really important to the state of our childcare system here in North Carolina. As we know, the pandemic has highlighted, and I think we all knew that, probably as moms and as parents, the importance of childcare to our economy, to our families, just to our general communities. But obviously, I think the pandemic has really shone a light on that. And I'm really glad that it's getting more attention. One of the silver linings, I guess, to the pandemic is that a lot of these issues that we've been probably talking about for a long time are now getting a lot more attention. So we know that the two really big factors in childcare are availability and affordability. So we know that childcare is obviously very, very expensive. As Representative Meyer said yesterday, we had the bill about unemployment on the floor of the House. And as he said, the Department of Employment Security has reported that childcare is actually the #1 reason why people aren't returning to work. It's not because they're getting too much unemployment or they're staying home voluntarily. And so I wanted to kind of highlight a few of the reasons. And the first thing I talked about was cost. And I said that the cost of childcare is more than an in-state college tuition right now in North Carolina, which is really crazy to think about, and that most families spend about 1/3 of their income on childcare. And also, if you make minimum wage, you only really have about $300 a month left to pay all your other expenses if you're also paying for childcare. So this is a huge issue. Of course, we also know that availability of childcare is a big issue, and the fact that many, many providers shut down. I think it's around 40% of providers shut down during the pandemic. We also know that 99 out of 100 counties in North Carolina are childcare deserts. And we also know that 19,000 plus children are on the childcare subsidy wait list. So obviously we have a huge problem in North Carolina, and passing House Bill 574 can make a huge difference. And it's just one step in making a change in the system here in our state. And if you don't know about the subsidy system, I had to learn about it the last couple of years, but really it's a system where our private childcare providers are reimbursed for delivering childcare to families that qualify and that they can access these subsidies. So it's called the subsidy rate. But unfortunately, there's a huge difference in how subsidy rates are paid across our state. If you live in Wake County and you have a provider in Wake County, they're given a lot higher subsidy rate than somebody, say, in Harnett County. So this bill would basically set a statewide floor for subsidy rates so that providers would be able to access more of that money. Now, the reason that's important is because we know that if a provider is getting more money from the state, they can pay their workers more. We also know we have a huge workforce problem in the state, that people aren't going into early education because the pay is so terrible. Most childcare providers live at or below the poverty level, and many of them do not have health care. So this raising the subsidy rate would basically allow providers to pay their workers more, which is super important. And then also it would give them more money just to provide, the things that they need to run their businesses. We also know that childcare providers are operating on very razor thin margins most of the time. And so this would also just give them that stability, to be able to operate their businesses more in a more healthy way. So the other thing that the bill would do, other than set the statewide floor, is it would just basically increase some of those subsidy rates, because right now we're relying on 2015 data to get to offer these rates. So basically update that data to at least to 2018 data. And so that would also provide that extra bit of money that those providers need. And it would also eliminate, there's a 20-month 20-month time limit for if a parent is receiving a subsidy and they're in post-secondary education, which I don't understand, but this would remove that so that if you are in college or a community college or post-secondary education, you can continue to get that rate, because we know we want to encourage, parents to go back to school or to continue their education. And a lot of times they drop out because they don't have assistance to keep their kids in childcare. So this bill would do a multitude of things. Even though it sounds kind of wonky, it would actually make a huge difference in the industry. It'd make a huge difference to our workforce, and it would make a huge difference to our parents. And I'm really proud that we do have bipartisan support for this bill. It was filed with myself and Representative Clemens on the Democratic side, and then Representative Willis, who actually owns a child care center in Union County. So he knows this topic, inside and out. He is a strong supporter of the bill and has been helping us run it through the House. And then Representative Zoka out of Fayetteville. So we have very strong bipartisan support. We got it through a committee in the House, and now it's sitting in appropriations. So for your advocacy day, I would encourage you to reach out to your members, to people on both sides of the aisle, and encourage them to pass House Bill 574 or include this funding in our state budget. It can be done either way. And so it's really, really important, like I said, for the future of our childcare industry. And again, it's just one step. We know we have many, many other things that we need to do to strengthen this industry, but I'm hoping that this is a step in the right direction. So thank you so much. And I wanted to just point out my shirt and say that today is Gun Violence Awareness Day, which is also a huge issue for our babies, our children. And so I hope that you all will wear orange today, post on your social media, and encourage everyone to end the gun violence epidemic in our country. So thank you so much.
Thank you so much. That was so wonderful, and the chat is just lighting up. Representative Von Haven, just saying thank you for the wonderful talk that you gave yesterday in support of children and families. I just appreciate the way you said that. In case you haven't heard about subsidy and don't understand what it is, I had to learn very fast, and it sounds like you educated yourself and you got right to work on making sure that children and families got what they needed, and to make sure that we continue to all galvanize and work in that direction to get what we need for these children, to have access to high quality education, right? And to also make sure that these programs have what they need to pay teachers so we can stabilize and improve this and strengthen our workforce. Thank you so much. Will everyone join me in providing a virtual round of applause for these incredible legislators? Incredible legislators, thank you for your time. Thank you for being a champion for babies. We will continue to follow you. You will continue to hear from us. And thank you also, Representative Van Haven, for calling out the other representatives that aren't here that are working on this. We need to know who's who's supporting Think Babies. We need to know who is putting their voice and their work behind our children and families. That's important for us to know that and to share that with our other colleagues, okay? Don't be a stranger. You're always welcome to come back and be with us. You don't have to wait till this time next year, okay? All right, and that's the same for all of you. So we will move on. If you can hang around for a little bit, please do. We're gonna catch up here and introduce our amazing parent panel members. So now it's time, it is my pleasure to introduce you to our panel of parents who are here today to share their personal stories about how some of these critical policies that were just mentioned or lack thereof impact their own families. So some of you probably wanna hear this if you could stick around for a little bit. First, we'll hear from Joyce Spencer about her experience with not having paid leave. Joy is also a member of the Think Babies North Carolina leadership team and is doing incredible work around this issue with an organization called Equity Before Birth. Love that name. Joy is unfortunately under the weather today, so she is here with us but unable to speak. However, we are lucky enough to have a video to play from when she delivered her testimony about paid leave to the House Ways and Means Committee in the US Congress just a few weeks ago. After that, we'll hear from Ashley Gentry, who will share about her challenges in finding and affording childcare. We're excited to hear about that, Ashley. Then we'll hear from Shaniqua Wheeler. We'll talk about how access to home visiting services has impacted her family. That will be a great share. And lastly, we will hear from Katie Walden about why access to reasonable accommodations in the workforce are necessary to ensure healthy pregnancies and healthy babies. So we'll start with the video from Joyce Spencer.
Hey, Rhonda, this is Elaine. I'm actually going to just put the link to the video
wonderful.
in the chat.
Okay.
Joy is unfortunately under the weather today,
Okay.
but please take a few minutes, watch her powerful testimony before Congress. She is just an incredible mom, an incredible community leader for our state. So
That'd be great. Thank you, Elaine. Okay, no worries. We'll make sure that we make that a priority, okay? Miss Ashley, we're excited to hear from you today.
Good morning, everybody.
Good morning.
Thank you for having me here to talk about my experience as an educator and as a parent. So speaking from that standpoint, you know, I've gone to school. I was a teacher, and now I have my sweet little 2-year-old daughter, and I want to be back in school. I'm currently back in school, continuing my education, but it has really been extremely difficult. It's been such a challenge being back in school because of a variety of reasons that I'm going to get into. But mostly thinking about the challenges of just childcare in general and the costs associated with that for families who are working is difficult. And now that I'm back in school, you know, I'm having to pay that tuition. Plus, if we want her in high quality childcare, we're paying more for her to be in school, you know, in a high quality environment than we are for me. Which, like we heard earlier, is it's hard to believe that's true. And so as a mother and as a parent, I have struggled with thinking about how do I focus on my dreams to continue my education, and by doing that, am I restricting my daughter to be able to be in a high quality environment because now we can't afford it? You know, so that's the struggles that I face as a parent, and I know how important it is in these critical first years of her life for her to have everything that she needs to be successful. And it's not only important for her, right? It's important for all of the kids across the United States and in North Carolina. And so it's just been a struggle for me financially. It's been a struggle for me emotionally, because I want what's best for my child, but I also want to be able to achieve my dreams. And so the struggle there is I have to sacrifice a lot just to be able to meet the demands of being in school while also trying to accommodate as a parent. And on top of that, we live in a rural county where it is a child desert. We don't have the options there that are even available for us to put her in a good high quality program. So there are lots of challenges, and it's really great to hear today that we do have these legislators and representatives out there advocating for these things that are really impacting me. To hear that they're out there trying to ensure that, you know, as my dream to continue my education and to better myself, that I'll be able to do that without having to struggle and worry about my child as well. So I'm so thankful for that. And I just wanted to let everybody know about my experience and to kind of hear how, you know, this is real life for me and for a lot of other families out there. And so I thank each and every one of you for being here and for advocating for not just my child, but for all the kids out there that truly need that support. So thank you so much.
Yeah, thank you so much, Ashley, for sharing your story, because you are exactly right. Your story represents so many families in our state. And we appreciate you for taking the time to represent those families. And that is such an important need. And I think all of you, I'm confident that all of you that are educators and professionals that have an opportunity to work behind the scenes understand how important this is. And I see that some of our legislators are still on the call, understanding how important it is to hear your voice and this need that you have, how critically it is important for us to address this, to really get our state where it needs to be, right? To make that early investment in children and families, to allow you to have access to high quality childcare so you can obtain that education, which stabilizes the economy. But you should not have to make that sacrifice, whether your child can be in a high quality, affordable environment so that you can get the education you need to be able to provide financial security for your family. Thank you for sharing your story. We're going to stand together on this, continue to move forward, all right? Don't be a stranger. Hang in there with Think Babies. We're going to get this work done together, okay? Next, we'd love to hear from Shaniqua Wheeler, if she would share her story with us.
Hi, guys. I'm Shaniqua. Just very quick, I'd just like to thank everybody for even inviting me to this. I feel like I'm just kind of like on the low end of things because everybody is kind of like legislators and all that, but I'm so honored to be here and be sharing my personal experience with everything that I've been going through, and how the program that I'm in, which is Imprints Cares, has impacted not just my immediate family, but I'm also trying to change the norm within my my family as a whole. So first off, let me just say that all the work that's been put into this, it has my heart in such an emotional state to know that this conversation is out of my home and out of my community, and moving up to a higher level, and people are actually noticing the struggles that us mothers, us Black women, us parents overall have. It's just a conversation that I didn't think we would ever move past our homes with. And so that right there alone has had my heart so touched this morning. So I appreciate you guys for all of the work that you've already put in. This is sank deep into my family as far as the home visiting, with providing education and books and resources. In my family, I grew up from a poor home. We didn't have books. We had very few connections with the community. There were a lot of trust issues within our home as far as people being able to provide the help. We didn't know if it was sincere. We didn't know if it was real. And some of it was just, we just didn't know it existed. And so we didn't have that. We didn't have those opportunities that my children do now. And I'm starting all the way from birth all the way to, I have a 7-year-old and I have a 2-year-old. And what's happened with me as a mom with my 7-year-old is very much different from what's happening now with my 2-year-old. Just speaking about birth, I had a cesarean with my 7-year-old because I didn't have the resources and the knowledge about being pregnant and how to take care of myself. And I came to a very close near-death experience with my 7-year-old. With my 2-year-old, however, with the support that I've received from these home education and visiting programs, I was able to have a VBAC. Okay, I had a natural birth and it was successful. I was happy, I was healthy. My son was healthy, he's still healthy, he's still happy. And just that alone itself is just giving me the confidence as a parent to be able to spark up these conversations and ask these questions that I may not have had confidence to ask in the past, that I know that I have access to now, or people are speaking about so that we can have access to right now. And that alone itself has increased my mental health and my self-care health. I'm being able to do things for myself that I didn't know that I had opportunities to do. I thought I needed a lot of money, or I thought I needed to talk to the right people, but it was just being a part of a program like Imprints Cares, bringing that information into my home, allowing me to read that information on my own, allowing me to reach out to these resources on my own, and just making a difference in my home all around. And like I said, you know, I'm even able to like reach out to other parents and know that, you know, I'm not the only one struggling with these issues. There are also other parents. And I think that that's what we need. I think that we need conversation within ourselves, within parents, like, look, you know, okay, this is what you went through. This is what I went through. We have got to do something about this. It has seemed so normal for so long. And it's not. It shouldn't be. It shouldn't be something that we get used to. I support you all the way, Ashley. Thank you so much for going forward and moving forward with your dreams. I know how hard that is. I myself have had to quit 2 jobs, several jobs. I have lost certification. I was doing CNA 1 and 2. Also pharmacy technician. I've lost all those licenses within this past year because of the pandemic, because I wasn't able to go back to work, get in those necessary hours for eligibility to renew my certifications because I didn't have childcare. My 2-year-old is currently at home with me now. I'm a stay-at-home parent. We have been so blessed for my husband to be able to continue working. And my 7-year-old, he's in school now, but it's just that I had to wait until he was able to get in school, you know, free public school programming, for I was able to be like, wow, am I even going to be able to afford to have another baby? Or will we be able to afford for me to go back to work? And right now, my husband and I are having conversations like, it doesn't even make sense for you to go back to work because we'll pick up 2 more bills. That means that I'll have to pay for my 7-year-old for an after school program and my 2-year-old for childcare. You know, so it's just like, it doesn't even make sense anymore, which, like Ashley says, it brings you to more of an emotional state where you're like, well, I can't even do the things that I need to do as a mom to support my children financially. But I am very grateful for my husband to be able to do that. But also, I just think that we shouldn't have to make those type of sacrifices. Now, I'm a mother, I'm a woman, I'm an aunt. I'm a granddaughter, and I know that as a family, we have to make some sacrifices. I just don't think that those are the type of sacrifices that we should be having to make. I think as a whole, the moms play an extremely vital role in the family, and being that head person and having that much power and pressure on you, it's not fair for us to feel like we have to be alone in all of this. And so with these home visiting programs, they've given me the opportunity to break habits within my home, within my family. I'm the first person in my family to breastfeed. It's just been such an honor. And like I said, these programs, I'll hope for funding and more areas like this so that we can build the confidence in other families and just help our children to grow as a whole. So I thank you guys so much for allowing me to be here and talk about everything that's going on in my family.
Thank you, Shaniqua. I think, listen, I don't know if you can see the chat, but we are all blessed by your story and by Ashley's story, and you inspire us to continue to do this work. That VBAC story, even Ashley said, you just sent chills. And Elaine put something important in here, just given the low stats of people that have access to that. Elaine, I just want to share this quick note that Elaine put: home visiting and parenting education, which is what you said, is which turned things around for you, changes lives, but only about 2% of all eligible families in North Carolina receive these services. It is so critically important for people to hear stories like yours, Shaniqua and Ashley. Thank you so much, because you took that education and now you're a leader. So continue until you get back to work. Continue to do the work that you're doing, sharing your story, inspiring others, letting people know about these resources, and letting us know how we can support you in your dream to continue your education and get back into the workforce, and also to support your babies, your children, your 7-year-old, your baby, and your family, your husband as well. Okay? We're in this together. Until we get there, we will not rest. We will continue to do this work every day, okay? And we want you to come back, both of you, and share the story to tell us how things have turned for you. Hopefully there'll be a conclusion to the story. In another year, you'll see the changes once we get these House bills passed. So I hope our legislators hear that. And last but certainly not least, Ms. Katie Walden, we're excited to hear from you. Good morning.
Good morning, everybody. I just want to thank everyone for this opportunity. I feel honored and blessed to be part of this discussion. I grew up in an abusive household where I never thought that my voice would be important enough or that I'd really have anything to say that anybody wanted to hear. And I think that so many women feel that way because of not just how we were raised, but how society is at this point. And I just want to thank Joy, who's not here. I can't wait to hear you, Ashley, and Shaniqua for joining me and realizing that our voices are what need to be heard. And hearing the representatives and Senator listening to our voices and making a change for the better. I don't really know how we've gotten here. A lot of society right now, and the COVID certainly has highlighted how we seem to be moving backwards, and we need to stop. We need to get together and move forward. I want to thank Senator Murdoch for introducing the Healthy Pregnancy Act into North Carolina. I have been taking notes. This is what my, all the things that I want to say, because that's how my brain works. I've been in all of the different positions and things that we've highlighted today. The Healthy Pregnancy Act is something that would help women in North Carolina. I understand we didn't get that heard, and if we can move forward and we can all get our voices heard and get our Pregnant Workers Fairness Act passed, it's heading to the Senate, and this is something that, in addition to all of the other great things that we're doing, is going to provide a start for moms and women who are thinking about building a family, so that we can have a better workforce, so that we can have a better economy, so that our children's futures are brighter. I know I only have 5 minutes, so I'm trying to think of the most important pieces and what this has meant to me. I've had 3 pregnancies. two of which were in sort of a more low-key work environment where I was able to get accommodations. I worked as a secretary and youth minister in a church. So I was able to bring my children to work with me. I was able to breastfeed, and I was able to, if I needed to sit down, I could sit down. If I needed to drink some water, I could drink some water. If I needed to go to the bathroom, I could go to the bathroom. These very simple things I could do during those two pregnancies. My third pregnancy, however, I was the primary breadwinner for a family. I was a regional manager for a company, and I essentially was running our branch solo. Very early on in my pregnancy, due to stress from my workforce environment, due to not having accommodations, because I was doing heavy lifting, because I was organizing events, because I was, running everything on my own, which I understand I took over those responsibilities. Because I was doing all of those things, I started having contractions. And I spoke to the CEO of our company. I tried very succinctly and in a logical way to communicate to him that if I don't have very simple accommodations, if other people aren't helping me lift 100-pound objects, if I can't go to the bathroom, if I can't take a break and sit down sometimes, I'm going to lose this baby. I was very simply told that this was my job, and if I was unable to perform it, that was it. We're in an at-will state, right? So employers at this point can let pregnant women and do let pregnant women go. We know that if our pregnant moms can't get the support that they need during pregnancy, we know that there's a high incidence of premature birth, which means those babies are starting off in a disadvantaged position than people that were able to get accommodations, than people that were able to get leave, that could take bed rest. I ended up choosing my baby over my job. That sent us into extreme amounts of poverty and debt. I hear a lot of representatives, lawmakers, senators, governors talk about the burden on our system that Medicaid and people that are on assistance bring. The reason why there is such a huge burden on our system is because we are unable to provide adequate care to women when they are pregnant. We are unable to provide adequate care to those babies when they are born premature. We are unable to provide the education, widespread education. We have an opportunity at the federal level to make sure that our future has the best beginning that it can. Our babies have the best beginning that they can have. And I have been to DC twice. Once was to talk about expanding the child care credit. And then the second, right before the pandemic, I was able to bring my two oldest, who at the time were 7 and 5, to DC, and they heard me speak. And I reminded them this morning, they're downstairs. I asked them to be quiet for about an hour. Work. I reminded them this morning about the work that we did. And my son, who is now 8, said to me, well, didn't it work? When we went last time, didn't it work? All of those people have mommies. It's really easy for children to understand that they're part of all of this. They're a part of this system. And they think that, well, doesn't everybody else understand that? And I encourage all of us to get out, to call our representatives, to make them understand that we're all in this together, that it's not just about businesses paying for things, employers paying for things. It's about all of us coming together to make sure that our children's futures are bright, that our babies are taken care of, that our moms are taken care of. And COVID has highlighted the disparity. I'm starting to get emotional because one of the things that I did was, when I left my corporate job and we went into poverty, I decided that I was going to do in-home care. My degree is actually in education, early childhood education and in art. And I decided I would open up an in-home daycare for moms who could not afford childcare for $30 a day. I was watching their children for as many hours as they
Wow.
needed, and making sure that those kids had a good environment, that they had good meals. And so I understand both pieces of it. Our childcare workers need to get living wages
That's so good.
because we need to provide excellent care for those babies.
That's-
And at the same time, parents that are working these jobs, they're not making a living wage. They can't provide a living wage to somebody else if they're not making one.
that's true.
We need to provide all of these opportunities. Our system is broken, and I urge all of us to use our voices to fix it.
You're so right. That's so powerful. Thank you so much for sharing that. And just talking about the measures, the small steps that we can take to ensure that companies understand how vitally important it is to keep moms in the workforce and to provide those accommodations and make it a family-friendly work environment to the best of their ability. We can do better. We can do more. And thank you for reaching out to our legislators and letting them hear your voice as well this morning, Katie. What
Thank
a
you so
great share. It's so wonderful. I'd like right now, if you will all join me in providing a virtual round of applause for our parents. These voices are critically important. They represent all of us. They represent our present and they represent our future. So please join me in providing a virtual round of applause and a sincere thank you to our parents for being on and sharing their stories with us this morning. All right, ladies. So next we're going to take a couple of minutes. We're going to try to catch up a little bit here, but it is important that we allow you to be able to share a few thoughts, those of you that are on the call today. So we probably have time for 1 or 2 questions, and Elaine is going to help me with the chat here a little bit. So I think we've kind of heard a little bit about what our top priorities are for policymakers. Our parents that are on really emphasize that. But if you want to respond to why do you think it's time to think babies, or what issues are most important to you and your community, why? Please raise your hand and Elaine will help me recognize you. And we want to hear from 1 or 2 of you, if you don't mind, if you're taking just a couple of minutes to respond to either of those questions, someone we haven't heard from this morning. Is there anyone that wants to share why they think it's so critically important for us to think babies at this time?
I'm not seeing any hands raised. Maybe everyone is wiping away tears like I am
Okay.
after this powerful story.
And that could be the case. And I think every story that was shared today, Elaine, and you probably agree, expresses exactly why we should be thinking babies and talking about what's happening in their areas. Has already been stated today. Okay, so if not, if there's someone that wants to speak, feel free to put it in the chat and we'll try to recognize you later. But if it's okay, Elaine and Angela, we will move on to our call to action. Now that we've heard from our legislators and our amazing parents, what's next? What can we do? What can we get our colleagues and our coworkers and our community members and our friends and family members to do to create this change that's necessary in North Carolina? Okay, give me 1 second here. All right, so it's time. If you see this, we'll do the 30-minute advocacy, talks about the 30-minute advocacy workshop. It's time to keep pushing for change so that we make sure policymakers know that it's time for us to make babies a top priority. We need every one of you to think babies advocates across the state to take action today. State policymakers, as they mentioned earlier, are working on bills and budgets right now as we speak that will impact babies and their families, and they need to hear from you. And we've made it easy for you to do that, to contact them. In your inbox, in just a few minutes, you will find an email with a link to help you call and email your state legislators. So you ladies from the Think Babies group have made that so easy for us. But feel free to add your own story. Let's let policymakers know. The ones that are on this call that were on today heard from you, but they mentioned many of their colleagues that haven't. We need to let them know when you call on them today and in the upcoming weeks that you believe that we know it's time to think babies. It's time to adopt policies built on the science of brain development that we discussed earlier. It's time to support budgets that put babies and families first. It's time to work for equity so that every child in every community in North Carolina has an opportunity to thrive. North Carolina babies can't wait. Please make those calls and send those emails. The author Graham Greene once said, there is always one moment in childhood when the door opens and lets the future in. We need to open the doors of opportunity for babies and families. This is why we think babies. It has been an amazing day. What a great day for babies, but let's be clear, it's going to take all of us working together to make sure that policymakers make this a priority. Okay, and before I pass it over to Jenna, who is our executive director, is there did we get anything in the chat, Ms. Elaine, that we need to address? Are we ready to move on to Ms. Jenna?
I think we can move on, but thank you all for all of the wonderful comments you put in the chat all morning today. It's been fun. Even if we can't be together in person, we can still think babies together.
Awesome, awesome. And Michelle Rivers put in there, please take action, call and email your legislators today. Use the Coalition's Action Center. There's such great information and resources up there. It's open now. We've made it easy for you. Share with your friends and families. Let's all agree, and I know many of us on social media, that we will look at our sphere of influence and we'll contact no less than 25 people, family members, people that we work with, and that they hear from all of us. And even our legislators that were on today said, make it a point that they need to hear from you and know what we're requiring, what we're expecting, what we know is necessary for us to provide for children and families in our state. So without further ado, Ms. Jenna Nelson. Thank you, Jenna.
Thank you, Rhonda. It's been so wonderful to have you as our host for Strolling Thunder today. We're so honored that you serve on our board and on our executive committee. You are so inspiring, and we're so glad to have you.
It's my
and
pleasure.
that goes to all of the wonderful speakers that we've had today. Everyone has really made the case about how important it is to think babies and how much progress we're making, but how much more we still have to do. We have to continue this work. And so right now, it's, as Rhonda was saying, it's really time for us to get down to the hard work of taking action. Shaniqua, I will say you started your presentation by saying, like, I'm just a mom. And there were so many of us in the chat. I don't know if you got to see it. Like, you are just as important and vital to this, if not more so than the legislators, because you have that story and you are the mom and you are raising our future. And so as moms, as advocates, as teachers, as childcare center owners, directors, providers, we all have to make sure that our legislators hear from us. And so we're going to break into some advocacy workshops so that we can really get to the heart of what it means to be an advocate and how to do the work of advocacy. So it's really exciting. When you registered, you chose which advocacy workshop you wanted, and you'll be getting your first choice. So there's 3 different workshops, and those will take place in breakout rooms. And our administrative director, Angela, is going to handle all of that in just a minute. We aren't going to come back as a full group. So once you have concluded your advocacy workshop, you can go ahead and leave and get the rest of your day done. I hope you enjoy the rest of your Friday. As soon as you close out, as soon as you're done with your advocacy workshop, please make sure that you contact your legislators and join us on social media so that we can get the word out. So Angela, again, is going to launch us into breakout rooms, but if you're not automatically assigned, just stay where you are and Angela will make sure that you get into a room. So if you don't remember, registering, you don't remember what room you're supposed to be in, just, it'll all happen for you. Just stay put and Angela will take care of you. So thanks everybody. I will see you all in the social media world.